this angle and all that. Okay, so the frontal mode is, and you guys can follow through with me on this anyway, is this part up here. This part in the front, right here. And I gave you two markings. Of all the markings that there are on this, I gave you two. The first one is the supraorbital margin. Supraorbital margin simply means above the eye, the orbit above the eye. And it's this ridge where your eyebrows grow. So your eyebrows grow there. And the second one are inside the bone in this area, are frontal sinuses. I will not put frontal sinuses on the pin test because you can't see them. Okay, I could put them on the lecture test because they were on the lecture portion of the senses. Okay, so that's fair play to put on that test. The second one are those down by the ear, right in the area of the ear, behind the ear. That's this right here is a temporal bone. Okay, so the temporal bone includes this bump down here behind the ear that you can feel behind your ear. That's called the mastoid process. Inside the mastoid process, there are air cells, okay, which are called mastoid air cells. These are not they are similar to sinus cavities, but they're not the same because sinus cavities communicate with the nasal area, your nose, whereas this communicates with the middle ear. Okay, so they're not technically sinuses, although they're very similar. Okay, the next part is this hole right here. This is where the flap or pinna of your ear would be. Okay, if we had an ear on the side of the skull. Okay, this is called the external auditory meatus, or the acoustic canal. It's called a number of things. Okay, meatus on the bone simply means a passageway through a bone. Okay, a tunnel, so to speak. Okay, the next one is this, the confusing one, is this part here. Here's this bridge that goes up here on the side of your cheek. Okay, and so this actually originates in the temporal bone and goes over here to the zygomatic bone. The part of the temporal bone that reaches out to the zygomatic bone is called the zygomatic process of the temporal bone. Okay? And then the last part on here is where your mandible fits into where it articulates, hinges. I get back into the right spot here. Hinges into the, with the rest of the skull. Okay, that's part of the temporal bone, and that's called the mandibular fossa. That's this depression where I'm putting my finger right here. Okay, and that head, this portion, this condyle of the mandible slides up into the mandibular fossa. So those are all the parts of the temporal bone you need to know. There are two temporal bones. The occipital bone is the floor of the skull, the back, lower portion of the skull right here. You can see those suture lines going around it. I give you two parts on it. The first one is a big hole where my finger is sticking in. That's where the spinal cord goes out of the brain, okay, down into the spinal column, and that's called the foramen magnum, or it's the largest foramen in the skull. Remember that a foramen is an opening through which a blood vessel and or nerve passes. Okay, then setting beside them, or beside that foramen magnum, are these two rounded bumps. They come down. Those are the ones that set on the first vertebrae, the atlas vertebrae, and they're called occipital condyles. All right, they articulate with the first vertebrae. Okay, the next one, I'm going to take the top off the skull and show you the bone, the depression right here where my finger is setting, in the center of the bone, in the center of the cranium. Okay, this bone is called a sphenoid bone, and it's a butterfly-shaped bone in here. Not worried about you knowing exactly where the edges are. That's unimportant. The most important thing, though, is that where the end of my finger is, my fingernail. That depression is called the sella turcica, or Turk's saddle, and that's where the pituitary gland sits. Extremely important protective device for the pituitary gland, with the brain sitting on top of it and bone surrounding it. Under the sella turcica are the sphenoid sinuses. Okay, again, you can't see them. They will not be on the pin test. They could be on the written test. And then the other one, and I will find my device here. these two openings, okay, in the skull, if I can get them through here. This one may be too small. The openings may be too small for me to slide it through, so I can't. Okay, but these are two openings that go out, that the optic nerves enter the inside of the skull. Here, if I had a real skull, it would be much easier to see. Okay, and those are called the optic foramen. Okay, openings. These are openings that to the sella turcica, but they come out from the back of the orbits. Okay, so that's a sphenoid bone. There's one sphenoid bone. Okay, next one is this bone right up in the front floor of the skull. Okay, there's a ridge that comes up right here. Then on both sides of that ridge, is a plate with holes in it. You may or may not be able to see holes in the plastic straws. You can't see it on this one. If you could see it on my real skull, you could see it okay. But this is called the ethmoid bone, very small bone in terms of the floor of the cranium. But this part that has holes in it is called the cribriform plate. Cribriform plate provides openings for the olfactory nerves to go down into the nasal cavity, so you have a sense of smell. Okay, so you can smell things. The part that sticks up, the vertical part that sticks up, is called the sella turcica. I'm sorry, it's called the chrysogali. Okay, which means cock's comb. It's like the comb on a chicken. Okay, and it's a point of attachment for the membranes that surround the brain called the meninges. Inflamed, it's called meningitis, so you all know that. Okay, then going into the nasal cavity, if you look right down into the nose hole, so to speak, okay, there is a partition in there. You want to yeah, so we're looking at that bony structure that forms right in the center of the hole in the front of the face where the nose is. Okay, and that divides the left nostril from the right nostril. Okay, and that's called the perpendicular plate of the ethmoid. And what it does is to just do that. It divides the nose into two areas. When this is bent, okay, this septum is bent, it causes a condition known as a deviated septum. Okay, there are also ethmoidal sinuses in the ethmoid bone. Again, you can't see it. Okay. Now the last bones are the cranium portion of the skull. Let's call that together here. Okay. Are the top sides of the skull. That's here. Okay, so there's this bone and another one on this side. And that's called parietal bones. Okay, parietal bones on the upper sides of the cranium. And there are two lines, which are difficult to see on these plastic skulls right here. Okay, that are the point of attachment for the temporalis muscles. Temporalis muscles are used in chewing. You can actually feel those on the side of your own skull. Okay, those are the 8 cranial bones. Now the face. Biggest bone in the face, okay, of course, is the mandible. Oh, you have a hard time.
The lid wouldn't go.
It's okay. Okay, the mandible is the lower jawbone. It's the strongest bone in the face. There's one, it starts out as 2, and those 2 grow together into 1. Okay, but there's one in you. The body is the part that forms the chin. That's where I'm holding on to it here. Okay, and then there are various parts. Okay, the first one would be the condyles. And the condyles are this. Okay, these, as you look at the side of the skull there, you'll see where at the back upper portion, the posterior superior portion of the mandible is a little bump that fits up into the temporal bone. That's called the mandibular condyle, and it goes into the mandibular fossa and forms the temporomandibular joint, okay, or TMJ joint, where a lot of people have problems with that. Okay, you'll see that in your practice for sure. Okay, then there's the part that holds the teeth. That part that holds the teeth is called the alveolar process, both in the mandible and the maxilla. It's the same thing. And then in the front of the mandible, on both sides of the body, there are 2 openings. Those openings are foramen, where nerves pass, blood vessels pass. Those are called
mental foramina, or mental foramen, okay? And that's one I often talk about. There's a point where the dentist